Hi, I'm Dave Whitney. Welcome to the short version of the Buurtzorg story, proudly brought to you by Desirable Futures. That's me, Alidad Hamidi and Ross McIntyre. Desirable Futures is all about finding ways to make work more human-centered for teams and organisations that want to make a real impact in the world, just like Buurtzorg. This is Jos de Blok, founder of Buurtzorg. Buurtzorg is the most successful healthcare organisation in the Netherlands, with over 16,000 healthcare professionals in over 950 teams. Buurtzorg's human-based, nurse-led approach outperforms all its competitors, with the highest client satisfaction rates, employee commitment and contentedness. According to Ernst & Young in 2012, Buurtzorg had a documented savings of around 40% compared to the Dutch healthcare system. But how did this all happen? To understand Buurtzorg more, and Jos's journey, we have to go back to the 80s and the early 90s, where Jos is a member of a close-knit team of other professional nurses working in the community. They're solving problems with the client, the patient, in home healthcare. The word Buurt in the Netherlands means community or neighbourhood, and it's working really well. They're able to work together with the patient and the networks in the community to solve problems together. In 1995, the government in the Netherlands was looking at how to make healthcare more cost-effective, to streamline things and make it more efficient. They believed that greater productization in the industry would lead to a better system. Their approach is pretty similar to what a lot of organizations do today. They decided to break down healthcare into many separate products, with separate billing codes and charges, essentially in an effort to make each product as efficient as possible and focus on efficiency for the provider, but not necessarily the client. This led to all sorts of interesting effects. It wasn't unusual for a patient recovering in home care to have 20 to 30 healthcare professionals all with their own charge code and part to play in the patient's care. For the patient, and for the practitioners, this was less than ideal. It's important to note that very little was done to consult the nurses at this stage on how healthcare should work. The results, unfortunately, were less than great. Contrary to their goals, costs more than doubled over 10 years, and the quality of the service from the client's perspective also took a dive. Due to all the parts not really working together, there were miscommunications, and failures and incidents were on the rise. With so many parts, the coherence of care for the client was degraded. Other professionals like GPs complained of a lack of communication and inclusion. Healthcare in the Netherlands was approaching a crisis. They had, it seemed, lost their focus on ensuring great outcomes for the patient. Jos, along with many others who care about what is happening, decide to make a bold move. With Gonny Cronenberg and Ard Lefrink, they found Buurtzorg in 2006, and the first team of 4 nurses is set up in Almelo, Netherlands. Their approach is based on the simple idea of providing the best outcomes for clients and improving their independence and quality of life. This is the Buurtzorg Onion. It explains some of the ideas that make Buurtzorg successful. The approach is based on the very human idea that people want to remain in control of their own lives, that they seek social interaction and warm relationships over transactional ones. It starts with a focus on outcomes for the patient. The Buurtzorg team members tune into the client and their context, taking into account the living environment, the people around the client, a partner or relative at home, and the client's informal network, their friends, family, neighbours and associations, as well as professionals already known to the client in their formal network. The Buurtzorg teams seek to build a solution involving the client and their formal and informal networks. Self-care, continuity, building trusting relationships and building networks in the neighbourhood are all important and logical principles for the teams. The Buurtzorg team members are all highly skilled clinicians, a self-managed and empowered team of highly capable professionals. In contrast to the productized model of healthcare, Buurtzorg teams provide continuity with all the products or tasks in one service. The teams are truly self-managing, owning both their operational aspects and the managerial or admin needed. From just one team of 4 nurses in 2006, Buurtzorg has grown to over 950 teams, consisting of over 16,000 healthcare professionals. Once set up, there is little need for support. Buurtzorg's back office is less than 50 people and only uses 27 coaches to support them. They also are connected by the Buurtzorg Web, an IT platform that links all the teams together. This houses the Omaha taxonomy system. It's a bit like a knowledge base, but it's much more than that. It supports the teams with access to clinical information that they need and ensures a high quality and coherent level of service. I mentioned some of the stats at the start of the video, but here are a few more. In comparison to its competitors, Buurtzorg has 30% higher client satisfaction, 18% better staff utilisation, and because they enable self-care as much as possible, they also have 40% less weekly hours with the clients, 50% less days in care per client. Hospital admissions are down by 33%, and the total costs of central overheads are down by a staggering 67% compared to its competitors. Imagine this in your own organisation. The results are nothing short of staggering. In traditional hierarchies with departments of specialisation, the management ensure the flow of instructions and strategy come down from above. In worst cases, silos pit department against department. Information on what is going on in the real world then sometimes flows back up, but has to go through many layers and filters. Because the teams are not self-managing, a level of coordination and control sits outside of the teams. Often many layers of management exist. In comparison to Buurtzorg, it is a slow and disempowering model. In Buurtzorg's approach, there is little to no divide between strategy and real life. They start with the needs of the community, place empowered and highly skilled teams in that community, ensure they are connected and supported by a platform, and provide additional support to them as needed. Because they are self-managing and empowered, they don't seem to need a lot of central administration or external control. Less than 1% of the company is not in the self-managed teams. These teams own how they work based on shared agreements and the human-centered principles of Buurtzorg. Essentially, Buurtzorg places a strong emphasis on humanity over bureaucracy. In this context, there are some extraordinary stories of care in the communities that they serve. I hope you've enjoyed this short story of Josta Block and Buurtzorg. It's a story that's obviously still being written, and of course it's just a short version and probably raises more questions than it answers. The Buurtzorg story is a great example of a present-day model for the future of work. If you want to know more about Desirable Futures, the future of work, or Buurtzorg, we are organising a free webinar on the 16th of September. This QR code will take you to a landing page where you can check out the details and sign up. The future is already here. There are companies like Buurtzorg in all sorts of industries around the world. They are part of a growing number of pioneering organisations tapping into the power of human-centric, self-managing teams to achieve remarkable success. Buurtzorg is now in 26 countries, including Australia, and we have been very fortunate to have connected with Arnold Strubuck, the director of Buurtzorg Australia. Arnold has kindly accepted to bring his knowledge and experience to facilitate training courses in October called Building Awesome and Empowering Teams, Mastering Buurtzorg's Self-Management Principles. If you are like Josta Block and want to shape the future of work and create a desirable future for you, your colleagues and teams, join us in collaboration with Arnold in Melbourne on the 8th of October and in Sydney on the 10th of October. Learn how Buurtzorg's principles can be applied to the teams you work with and potentially the organisations you are in. Use the QR code here to get the latest info on what it's all about and how to get your tickets. Hope to see you there. Well, that's the end of the video. Let us know your thoughts and feel free to drop your comments below. If you have any suggestions for future videos, also let us know. Make sure to like, subscribe and turn on notifications so that you're kept in the loop as well. Thanks for listening. Till next time, I'm Dave Whitney, and along with Alidad Hamidi and Ross McIntyre, we are the founders of Desirable Futures. And we know that together we can make a more human and desirable future.